Welcome to this video on HIPEC for ovarian cancer. This is Dr. Vinay Samuel Gaikwad, Director Surgical Oncology at Fortis Hospital, Manesar. So HIPEC, which is Hyperthermic Intraperitoneal Chemotherapy, is gaining more popularity for many advanced abdominal cancers. In this video, I want to discuss about the timing of HIPEC in ovarian cancer and when is the right time to undergo a surgical procedure for patients with ovarian cancer which is spread to the abdominal cavity or the peritoneum. So there are three periods of time in which a patient with ovarian cancer will undergo a surgery. The first is what we call an upfront CRS. That means as soon as the patient is diagnosed with ovarian cancer, before receiving any chemotherapy or any form of treatment, the very first procedure is called a CRS, which we can add an HIPEC to, which means a cytoreductive surgery with HIPEC. So the evidence for doing upfront HIPEC is not very high, but it has its advantages because the abdomen is pristine, hasn't undergone chemotherapy, the patient is strong, and so on. The second is called an interval cytoreduction, which means the patient receives surgery and HIPEC after 3 cycles of chemotherapy. That is called, again, I repeat, interval cytoreductive surgery. This is probably the best time to get HIPEC because chemotherapy has been given, the tumor has shrunk down, we understand the tumor biology better, and the patient is still not received the complete line of chemotherapy, so there is still healing powers and recovery that the patient can have. And the third time is called a secondary CRS, which is after, heaven forbid, the patient or the cancer has recurred in the patient, and that is called a recurrent situation or a secondary cytoreductive surgery. In this case, we have recent evidence and trials that show advantages of adding HIPEC to the surgery even at the second time. So these 3 times, the upfront surgery, the interval cytoreductive surgery, and the secondary cytoreductive surgery, there are 3 times that HIPEC can be given. All 3 times are valid for patients to undergo HIPEC, and the best time is interval cytoreductive surgery. Secondary time is also a good time to get HIPEC if the cancer recurs, and upfront surgery, the evidence is mounting, and many centers are performing HIPEC for upfront cytoreductive surgery because HIPEC has been shown to increase survival in patients with advanced abdominal cancers, especially ovarian cancers, and also improve the quality of life. So I hope this short video has made you understand that there are 3 times that HIPEC can be performed in patients with ovarian cancer: one in the upfront setting, the interval setting, and the secondary setting. Thank you so much for your attention, and we look forward to your watching more videos regarding such topics.